So we're going to do some rapid fire reviews of every learning plan for this class. But all my students, I do encourage you to go out there and take all the practice exams. Again, really get familiar with those practice exams. If you do good on the practice exams, you'll do good on the chapter exams, and then you'll do good on the final exam. So take those practice exams again and listen to all of these reviews. I'm going to go very quickly through this. I'm not going to hit all the information. I'm going to hit important information. So we're going to keep this focused. Learning Plan 1 and 2, basic pharmacology. And what is pharmacology? It's the science or study of drugs. And a drug is any chemical that has a physiological, or affects the physiological process of a living organism. So almost anything can be considered a drug. But drugs and medicines are different, okay? So what falls in the drug category? Well, prescription medications, over-the-counter, OTC medications, and sometimes prescription medications become over-the-counter medications. Dietary supplements like herbs. Now, herbs are in the category of drugs, but not the category of medicine. There's no confirmed and proven evidence that herbs are safe and effective in treating a diagnosed illness. Even though people think they can be used, and maybe they can, but there's no evidence. So until there's evidence, they're considered dietary supplements. And excuse me, there are a lot of herbal supplements out there that can be used for many different things. Things that people claim that things like ginkgo biloba helps memory. St. John's wort works for minor depression. Kava helps sleep. There's a lot of herbs out there. But again, they're not medicines, they are food supplement. And that is the big difference between a medicine and an herb. Medicine has science behind it proving that it's effective in treating a specific condition, and it must comply with USP standards. Herbs don't. Controlled substances, controlled 1, C1 is for anything that is has no medical use in the U.S. and has the highest abuse potential. Controlled substance 2 or C2 has a high potential for abuse, but does have accepted medical uses in the U.S. Schedule 1, marijuana, heroin, LSD. Schedule 2, cocaine. As we move through 3, 4, and 5, as we get to the 3s and 4s, each of those gets less and less risk of addiction. The nursing process is critical to understand. You will be using the nursing process for everything you do in your nursing career. The nursing process is very simple. The first thing you always do is you assess. You gather data. Could be subjective, could be objective data, but you gather data. And then you compile that data and you create a nursing diagnosis. After you have the nursing diagnosis, you come up with a plan to treat that diagnosis. Once you have the plan, you implement the plan. You put it into action. And then you evaluate. How did the patient respond to your plan? And that evaluation leads you to the next assessment. That is the nursing process, and that will be used in every part of nursing you will ever encounter. Remember when we're learning generic names a lot, because generic names are covered on the NCLEX. There's a lot of generic names that are important to know. And we look at the suffix of the generic names, and those will help us understand what category we're looking at. So April is going to be an ACE inhibitor. Prezol is a proton pump inhibitor. LOLs, the classic LOL, beta blocker. Dipines are calcium channel blockers. Tidines are H2 blockers, histamine 2 blockers, and statins are those cholesterol lowering agents. Now, don't forget also there could be CR or XL or XR. Those are all indicators of sustained or continuous or extended release. And those pills cannot be crushed or chewed. They must be swallowed whole. Some key terms we have to understand are the pharmacokinetic factors. There are 4 pharmacokinetic factors: absorption, distribution, metabolism, and elimination. Absorption is simply your body drawing it up. And things that can affect absorption primarily is the route of administration. Oral pills need to be swallowed and dissolved. That's slow absorption. IV is immediate absorption. Transdermal, a patch that goes through the skin, is slow but continuous. IM or sub-Q, faster because it's injected in. So the route will affect how fast it's absorbed. When it comes to oral medications, other things can affect absorption, such as food in the stomach or no food in the stomach, the presence of acid or no acid. So there are many things that affect absorption. And oral medications also have a key topic called the first pass effect. And that is, as the medicine is absorbed, the first thing it does is it goes through the liver. And the liver starts to break it down. And that's the metabolism. But we're going to get to metabolism after we talk about the pharmacokinetics. Pharmacokinetics, the movement of the drugs. So it can move through the blood, and it is distributed throughout the body. Now, something that can influence distribution and the pharmacokinetics would be protein binding. Some drugs have a love for protein. They grab onto those protein and they don't let go. When they're protein bound, it's hard for your body to distribute those drugs to all the end sites. Water volume, dehydrated or overhydrated, will affect distribution, as will blood pressure, heart rate, activity level. So first the medicine is absorbed, and then it's distributed throughout the body. And then it goes through the liver. Now the liver starts to break it down, and that's the metabolism of a drug. Now if you have a person with an unhealthy liver for whatever reason, be it hepatitis C or any hepatitis or cirrhosis, liver metabolism will be slower. So the drug will last in the system longer. Much greater chance of side effects and adverse reactions the longer it's in the system. After metabolism, after the liver has done its breakdown, your body excretes it. Primarily it excretes it through the urinary system or the fecal system. Could be either or both. Now we have to think about that. As patients get older, all of our systems slow down. So if we have a person who's elderly and they have frequent bowel problems and maybe constipated at times, or just having very slow bowels, that's going to delay excretion. So we have to take that into account. Also the drug half-life. Every drug has a half-life. And the half-life is determined, it's that length of time that it takes your body to break down half of the drug in your system. If a drug has a half-life of 1 hour, in 1 hour, half of that medicine is gone. In the next hour, half of what remains is gone. The next hour, half of what remains is gone. In general, after 5 half-lives, your body has effectively cleared all the medicine. Now, why is it so much at first? From concentrations. When there's more drug in your system, your body can eliminate it faster. So as your body eliminates it, the rate of elimination slows down. Now, what can affect how much is in the concentrations in your system? Well, I mentioned before, hydration level. In pediatrics especially, peds patients, the young children, have a much higher ratio of water in their body than adults do. So because they have a higher percentage of water in their body, they need more medicine to reach the same level effective concentration as an adult. So that has to be taken into account also. 3 other key terms that we have to look at are onset, peak, and duration. Onset is the time that the drug first starts having an effect. And you can find that in most drug guides. So that's onset. Now the peak is when the drug is having its maximum effect. And there's always a level where it peaks, and after the peak, it starts to slowly go down. But as long as it's having an effect, that's the duration. Onset, peak, duration. Very important to keep in mind, and that feeds into also half-life. We have to look at antagonist and agonist medications. Agonists are drugs that create an effect. Antagonists are drugs that prevent an effect. So just remember those two words because we'll be using those a lot. Bioequivalency is important, especially when working with hormone-based drugs, thyroid, birth control, insulin. If you get on a medication that works, stick with that specific brand. Don't change. Because while insulin is insulin, insulin really isn't insulin. And it can be slightly chemically different. So you want to stick with one brand. Things like acetaminophen. Acetaminophen is acetaminophen. That will be bioequivalent. We need to talk about minimum effective concentrations. That is the minimum amount in the body to have any effect. And usually there is a therapeutic window where it works. Underneath that window, the drug does nothing. Over that window, you start developing toxic effects. So that's where we need to keep it. We want to get there as quickly as possible and stay there. Now sometimes we'll use a loading dose, which is a large quantity of medicine at the first dose to quickly bump our concentrations, our blood concentrations up to that level. And then we'll just take little doses to keep ourselves bouncing in there. That's a loading dose. We're always going to monitor for side effects, toxic effects, allergic reactions, idiosyncratic reactions, and teratogenic effects. So side effect, those are predictable effects. Most commonly, antibiotics, the most common side effect is nausea, vomiting, diarrhea. That's a side effect. It might not be pleasant, but it's predictable. Toxic effects are what happens when you have too much in your system and you start getting poisoned by the drug. Allergic reactions are almost always very specific to rashes, itching, swelling, hives, angioedema, anaphylaxis. That's an allergic reaction. An idiosyncratic reaction is a reaction exactly opposite of what you expect. Benadryl in children has an idiosyncratic reaction. When adults take Benadryl, they tend to get drowsy. Children tend to get wired. Keep that in mind if you have young children. Teratogenic effects, those are drugs that will cause damage to the fetus, either while the mother is pregnant or breastfeeding. Variations in people that can affect client response are the obvious things: age, gender, body weight, body surface area. Disease states, if you have liver or kidney disease, that will affect your response to medications. Genetic factors. Some people are born with a genetic predisposition for one reaction or another. The placebo effect. If you believe that medicine will help you, very likely it will help you because you're believing it will. Administration time. If you give a medication, for example, prednisone, ideally you want to give that in the morning, between 6 and 8 in the morning, because that's when your body normally peaks its corticosteroid release. So you will get the best and most normal response if you take that medicine in the morning. If you take it at night, you're trying to change your circadian rhythm. And tolerance. People develop tolerance to medications. It's very common for people with chronic pain to develop a tolerance to pain medicine. So people can become non-compliant. Why? Well, one of the most common reasons are they can't afford the medicine. Medicines can be very expensive. Another one is they can simply forget the routine. There might be a complex regimen where they may have to take differing doses based on different situations. Insulin sliding scale is that an example of that. Could be the side effects. If you're taking medication and you get nauseated every time you take it, you may consider not taking it. If you take a medication and you develop impotence, you may consider not taking it. And the inability to obtain medications. Maybe the medication isn't available. There's a shortage. In the not too distant past, there was a major shortage of Tamiflu during flu season. So that can be a major effect. So that is the basics of pharmacology. That's all we're going to cover in this one. Come back next time and we're going to quickly go through antimicrobial agents.